Thank you all for being here. I wanted to talk with you today about masking in healthcare. This presentation is, of course, focused where I am in Dane County, but this is relevant really for everybody. There's some stuff that's focusing on Wisconsin, but if you aren't in the local area, that's totally okay. There's a lot of information here that's relevant for everybody. So a little bit about me and my background. I'm a physician scientist, MD, PhD. I'm a pathologist, so I specialize in laboratory testing of all kinds, and I particularly have a subspecialty in cytopathology. That's particularly in small samples, and my focus is on cancer diagnosis and precancer diagnosis. So I'm mostly working with a microscope rather than a stethoscope. And you might be wondering, why am I so invested in sharing this awareness about COVID and using multi-layered precautions myself? When the pandemic began, I really focused on how to protect my relatives who were, some of them were elderly, immunocompromised, or otherwise high risk. And I really wanted to figure out how I could get them the best information, the best kind of protection that they could have, and really try to help them navigate the pandemic safely. As I've learned more and more about COVID, I realize that all of us need protection, and that includes myself. So I'm really taking precautions for myself as well. I personally don't want to miss work or risk a severe acute illness. And as we'll learn about, we don't always know who's going to get really sick with COVID. And I definitely don't want to have long-term consequences of COVID infection that we know as long COVID. That could affect my ability to work and do a lot of the things that I enjoy most in life. So what are our goals for the presentation today? First, I want to raise awareness about the current COVID situation. I'm going to present some information that might be a little bit surprising for some of you who aren't in the know, or might be stuff you know already and might be a bit of review. I really want to show why universal masking in healthcare is so important. I'm going to give you resources and you can refer back to these. So if you don't catch everything the first time around, we've got a handout that you can refer back to. I'm sharing the slides from today's presentation, and we're really hoping to encourage further discussion. In thinking about this, I really want to discourage people from taking a view of fatalism or having any kind of all or nothing thinking about COVID. These are some of the most difficult sort of cognitive biases that we're going to face, some of the ways that we think about things that aren't helpful in trying to protect ourselves and trying to change our communities. So today, I really hope to inspire you that you can protect yourself, you can protect each other, you can protect your friends, your family members, and you can take action in your community to improve the situation. It's not necessarily easy, but little by little, we can make a difference. And we invite further discussion. There will be time for questions and answers today, and then you can follow up with us through this email address, as well as other social media channels. So when we think about COVID, you might think about kind of the common perception. And when I'm thinking about this, I'm thinking, what would someone think if they hadn't had a really severe personal experience with COVID, or they hadn't had a family member who was severely affected by COVID? And if you just right off the top of your head, you might think about things like taking a COVID test, maybe something like one of these rapid antigen tests, or feeling sick for a few days and needing to isolate for a certain period of time. But this is really just the beginning of the impact of COVID on our lives. And some of this you may know well already, but some of it may be new to you. So our reality of COVID goes much further than this. We're seeing that young people are severely impacted by COVID. Here we have an article showing young people have a higher risk of heart attacks after COVID. We have a large number of US adults affected by long COVID, estimates of 19 million. That's a huge impact on the population, and that's a devastating impact for the individuals who are severely impacted. And then we see COVID becoming a really leading cause of death. The news was that this dropped to the 4th leading cause of death. And many people may be surprised to even know that COVID is in the top 10 causes of death in the United States. And the last thing I want to leave in kind of our COVID reality, when you think about the impacts of COVID, I really want to let you know that there's a lot that I can't fit into a short presentation about the impacts of COVID. What I like to say about this is that I want you to think about your body and the favorite thing that it does for you, the thing you would really hate to lose, your favorite bodily function, if you can think about it that way. Most of these organs can be impacted by COVID. There's hardly any organ that's not on the list of organs that may be impacted in either acute or long COVID. This is particularly from a publication about long COVID. So the impacts are really systemic. It's not just a respiratory virus, and we're just beginning to learn about these impacts. We have a long way to go. I wanted to speak a little bit about the end of the federal public health emergency. This is what's really bringing a lot of these conversations to a head. A lot of the decision making that's happening right now is like, well, now that the public health emergency is over, we can blank. So I wanted to talk a little bit about what this means and what it doesn't mean. So a big thing that's impacted by the end of the federal public health emergency is funding for things like data reporting. And on the left, you can see an example of a community transmission map. This is showing COVID transmission in our communities. You might remember that over a year ago, the CDC actually switched to a different map that was more pastel colored and didn't really represent the case counts as much, but was more based on hospitalizations. But they still tracked these community transmission levels. And this was really useful information because you could see a reflection of the testing that was going on in your community. Now we've seen not just a drop in the data reporting, so you can see, before the end of the public health emergency, we had this map, and now after May 11th, this is no longer being reported. It was really sad to see this map just go completely blank. So we don't have that information, and we also see a great reduction in testing access. So there are a lot of impacts of the federal public health emergency ending. It means the end of funding. So I mentioned data tracking, testing, end of some of the funding for vaccinations, at the end of Medicare waivers. So there was expanded coverage for both Medicare and Medicaid, and that has been dialed back now. We've gone in the wrong direction as far as providing basic health care for people in the United States. So the end of the public health emergency does not mean that there's been any significant change to COVID cases, hospitalizations, or death in the recent period. And it also doesn't mean that there's a change in the risk of short or long-term consequences from COVID infection. So we'll talk a little bit more about those consequences a little later. But when we think about the impacts of the end of the public health emergency, it's important to know that these impacts are not fair. And the way that they are not fair actually impacts all of us. What you need to know is that people of color are disproportionately impacted by the end of the public health emergency. Particularly, here's one example from the NAACP, that more than half of those who are expected to lose Medicaid coverage are people of color. And then lots of children of color also impacted and potentially losing coverage because of the end of the public health emergency. The NAACP, by the way, also has a letter that you can sign on to supporting expanding Medicaid coverage. So I'd really encourage you to do that. But the thing to know about this loss of coverage, it isn't just about individual healthcare coverage. This is how a lot of Americans access basic public health resources that we should all have access to. So this really does impact all of us. It impacts people's ability to keep themselves safe and also to stop chains of transmission. So you've probably also heard that the World Health Organization ended the public health emergency of international concern. This is a really confusing and frustrating time. It kind of seems like all of these things are ending, and the messages might be going in a direction of saying, well, but isn't COVID over now? Well, I wanted to give you a quote from the Director General of the WHO that was given at the same time that the public health emergency of international concern was ended. So here's the quote, and let me just load this slide. There we go. The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about. So this is a lot of mixed messages. It's very confusing, but it's really clear that COVID still poses a threat. What's going on in the state of Wisconsin? And I really like to highlight our state data. The data collection here has been pretty good. We don't know how that's going to be impacted by the end of the funding with the public health emergency, but at least what we can see on our state dashboard is really helpful and informative. So you can look back throughout the course of the pandemic, looking at, the early days of 2020, we can see surges, and we can see here you have the Delta surge going into Omicron here, the first Omicron, and we've continued into other Omicron variants going forward here. But you can see in the recent, basically in the last year, we've kind of been cooking along at a fairly steady pace. There isn't a precipitous drop off. And so this really highlights that there is not a scientific basis for ending the public health emergency now. There is no scientific basis right now for dropping any kind of protections. We really need to keep those protections in place to keep people safe. So with the end of some of the data reporting, you might be wondering, how can we get a better idea of what's going on? And wastewater is something that is going to stick around at least for a while. None of this is set in stone, but there is some more extended funding for wastewater testing. So that seems to be a promising way that we'll be able to at least get a rough idea of what's going on. So I wanted to give you a little window into what wastewater testing looks like, and also highlight how it kind of shows some of the gaps in our testing access that have developed. So in this graph, you can see wastewater testing in this sort of rusty orange color. And then you can see actual COVID case data from people getting, nasal swab or saliva testing in the gray line. And you can see these track roughly together reasonably well. It's not perfect, there are some gaps. And it's important to know these levels are not exactly the same. They've been normalized so that the peak of the wastewater testing is the same as the peak of the individual testing case rates. So that's the data have been normalized so you can compare them on roughly the same scale. So here you can see that Omicron peak where the cases were really high back in January of 2022. And then you can see more recently, the thing that is really notable here is that the testing data here in gray is much lower than the wastewater data. We have a really large gap between the wastewater data and the testing data, and that has continued. So even though it looks like we're at a little bit of a lower place right now, when you can compare it back to summer of 2021, which was a previous low point, we're still about 3 times higher in the wastewater levels than we were at that low point. And the gap between case counts and wastewater levels really shows the effects of decreased testing access, which we know is going on. We know it's really tough to get a PCR test, and those are the tests that are counted, or at least have the potential to be counted. I wanted to go on to tell you a little bit more about the impacts of COVID as far as health impacts. And one thing that may be surprising to many people is that young people are severely impacted by COVID. So this was a study from Mayo Clinic that particularly showed that people aged 25 to 44 had an increased risk of heart attacks after COVID infection. That risk was increased by 30%. So that really doesn't fit with the narrative that we're often being given, that it's people who are older, people who may have existing risk factors. These are young and healthy people who are having an increased risk of heart attacks from COVID. And this is a really important thing to know, that the risk is not negligible or minimal for any of us. There's a risk for all of us in being repeatedly exposed to COVID, and we should protect ourselves. Next, I wanted to talk about deaths from COVID. And of course, that's really the worst outcome. Many of us have experienced loss of loved ones from COVID, and this continues, unfortunately, to be a major problem that is being downplayed, unfortunately, in the approaches to COVID and the media narratives. So I want to particularly highlight in this graph, looking at the years 2020 and 2021. There's partial data from 2022, but I do have an update update from 2022, but in 2020 and 2021, COVID was the third leading cause of death in the US. And that's incredibly remarkable because the top two causes of death are things that are very heterogeneous. They have a lot of different risk factors that contribute to them. You've got genetics, you've got activity levels in heart disease, you've got diet, you've got medications that can potentially be used for prevention, and all these different things that can contribute to someone's risk of heart disease. And it's really kind of like a really broad multifactorial thing that is sort of a lifelong risk. And then we also have cancer, which cancer is actually a bunch of different diseases that are kind of lumped together in one category. So if we look at these top 10 causes of death, we don't see any other individual infectious diseases separated out. COVID is the only one that's a leading cause of death. The only other I would say here is an other respiratory. This would probably include other respiratory viruses. However, COVID is still a leading cause of death. And in 2022, the big news was that COVID dropped. It dropped only to number 4. So only accidents kind of came above. So COVID dropped down a little bit, but it's still in the top 10 leading causes of death in the US. And it's really, really underappreciated the impact that COVID deaths are still having. We're seeing the impact of this in our overall life expectancy. Unfortunately, we are seeing a decline in life expectancy that hasn't yet rebounded. And this is something that is a greater impact in the US than it is in other countries. And definitely there are many factors that lead to, that go into life expectancy, but COVID is a significant contributing factor to this reduction in life expectancy. I wanted to highlight the risks of COVID with repeated infections with this wonderful study. This was a really extremely well done study. The references that I've included for this include the research paper itself, as well as a sort of a news article that's a little bit more digestible to read about it. So this was a study by a group at Washington University in St. Louis, looking at the impact of repeated infections. And so what we're really looking at here is a lot of different serious consequences of COVID and how they are impacting people with repeat infections even more than someone with their first infection. So your first infection has some impact, and then repeated infections have even greater impact as far as things like the risk of hospitalization, cardiovascular disease, diabetes, gastrointestinal disorders, mental health disorders, neurological impacts, pulmonary function, lung function, and all these things. So you can see that there's a much greater impact of repeated infections compared with just the first one. So if you've already been infected with COVID in the past, it's really especially important to protect yourself from repeated infections. And too few people know this. I wanted to speak importantly about long COVID, and this is data that was reported by the CDC in their publication, the Morbidity and Mortality Weekly Report. They have estimated that 1 in 5 adults have health conditions that may be attributed to their previous COVID-19 infection. This is all adults age 18 plus, so it includes people who were previously healthy and people who didn't have any pre-existing conditions or risk factors. So 1 in 5, that's a huge impact. There are many different estimates of rates of long COVID. It's really kind of tough to get our heads around and get a good study on, because it ranges so many different conditions and symptoms, and we're still learning really what long COVID is. And so you can see that there's going to be some variability in understanding this, but 1 in 5 is a huge impact. And if you look at people, the same study, they separated out people who were age 65 and older. The risk of long COVID in those patients was 1 in 4, so an even greater impact for older adults. And so why is this so difficult for us to wrap our heads around? Well, it turns out the science of long COVID is really in its infancy. We can't really treat a disorder when we don't know what causes it. So this graphic from a really nice review in Nature, a Nature journal, highlights 5 different hypotheses for how long COVID might work. We know that many people are impacted by clotting disorders and what we call endothelial abnormalities. So the lining of the blood vessels becomes damaged and abnormal in some patients. But there are many other ways that long COVID might work, and we really have to understand what these mechanisms are in order to figure out how to target them, develop new treatments, and we're kind of a long ways off. There is research in these areas, and it's definitely something that is being studied. There are a lot of people working hard on this, but we really don't have an immediate fix for long COVID. It's something that would be much better to prevent so that we can kind of stem the tide of additional cases. So I want to make sure that you know that up-to-date vaccination, including the bivalent boosters, reduces your risk. So it's really worth getting up to date, but it's important to know that these boosters don't eliminate your risk of infection. They don't eliminate the most serious risks. They just reduce the risk. So we're not talking about 100% reduction. We're talking about the bivalent boosters reduce the risk of hospitalization and death by about 60%, and they reduce the risk of symptomatic infection by about 50%. And this protection does wane over time. So it's really important to get up to date. Having that protection is definitely better than not having it. If you are infected despite your best efforts, you want to have that protection. But it's not enough alone by itself. We need other measures to protect ourselves. And I wanted to say too that this immunity wanes over time. You should get an updated booster if you're eligible, and the ideal would be at least every 6 months. The other thing to know is that vaccination reduces but doesn't eliminate the risk of long COVID. So this is a great thing that we have something that can reduce the risk of long COVID, but that reduction by only something in the range of 15 to 30% really isn't enough by itself when you think of some of the consequences that could be quite, quite devastating lifelong. So when we're thinking about COVID, what makes another thing that makes this so difficult is that COVID is so contagious. I mentioned earlier that we're now dealing with all kinds of different Omicron variants. If you remember back to the original Omicron surge, this is actually from the Department of Health and Human Services saying that Omicron is the most contagious variant yet. I think people may not remember that actually COVID has been getting more and more contagious with subsequent variants, and all of these different subvariants of Omicron, which you can see here on this evolutionary plot, are all highly contagious. So it's really important that we take really strong precautions in protecting ourselves. So the summary so far: COVID infection poses significant health risks to all of us in the short term and long term. So this is even young people, people who are previously healthy, and people who are vaccinated. We can all experience severe consequences of infection, and the current variants are highly contagious. So that all sounds quite a bit daunting. We'll take a quick break after this, but I just want you to know that prevention is possible, and we need many types of action. We're focusing today on healthcare masking, which is really simple, but we need action on many different levels to make this happen and make things safe. So before we go on to the second part, I want to open it up for questions, if there are any. I want to thank Barbara for sharing the Madison COVID Memorial website. I hope people will check that out and share if they've lost a loved one to COVID.
We do have a question from Natalia. Natalia, do you want to unmute?
Sure, thank you. I'm not sure if this is something that you'll be getting to in the second half, but I as someone who's higher risk and a UW Health patient, I'm really curious if you have any data on some of the risks around one-way masking. So I always wear an N95 when I go into public places, and the only public places that I go into are UW Health facilities. But I'm curious, yeah, if you have sort of guidelines around what happens when folks around you are not wearing a mask.
Yeah, that is a very key question. It's a very important. I will be talking a little bit more about that, but just to give you a preview, one-way masking really puts a lot of pressure on the fit and filtration of your mask. So definitely. N95 respirators work really, really well. So if you're wearing something like that, you can count on it to reduce your risk. However, we know that universal masking is so much better because it actually multiplies the protection. So if everyone is wearing one, you're counting less on having a perfect seal and having everything perfect all the time. We know that none of the protections that we use are perfect in and of themselves, but I think if you're doing one-way masking, having the best respirator that you can is very important, and we can talk more about that too if people have questions. But the N95 respirators, we'll talk about the sort of practical use versus sort of the potential filtration. The N95 portion of the N95 is actually like 95%. Most the actual filtration actually exceeds 95% filtration for particles that are of the size that could be infectious with COVID. So N95 respirators really work very well. Other high filtration respirators like KN95s and KF94s are also high filtration material, although it's a little trickier sometimes to get a really tight fit and seal. That's why I recommend N95s, but surgical masks definitely are not enough. But I don't know if that I'll present a little bit more, but I don't know if you had any follow-up, Natalia.
Sure. I mean, some of the information that I've seen out there suggests that if you are wearing an N95 and you're in an enclosed space with someone who's not wearing a mask at all, 15 minutes is probably very low risk. And then after that, it goes on. So that's sort of been my general rule of thumb.
Sure. I've seen these kind of numbers. And so the thing that I'll say about this is we never get to know how much virus we're exposed to, and it depends on a lot of different variables. So there isn't really reducing the time you're exposed is really important if you can, but when we're in healthcare settings, we may or may not have control over that. So, you might be able to negotiate not waiting in the waiting room, or, to have them call or text you when your appointment is available. But there are a lot of factors that are beyond our control, and I want to make sure everyone knows that N95s actually don't have a time limit as such. That's one way that the data can be misinterpreted. What is being conveyed when that time is given is more of like a way to compare different respirators. So they're kind of giving it a protection factor, kind of like SPF or something like that. So, but the idea of reducing time is really important, but we're not really guaranteed a safe amount of time. I think that having the best respirator you can and making sure that it fits you and seals around the edges really well is important. You can do user sort of fit and seal checks. We can talk more about that maybe at the end too. And then there is fit testing, which I didn't include in the presentation. It can be a little bit harder to access, but there are some DIY options as well that can help you get an idea if your respirator is fitting you really well. Do you want to take another question?
Yeah, Kaylee was next. Do you want to go ahead?
Yeah, so I was wondering, we've been told that there are specific groups of people that are high risk, those with autoimmune conditions, elderly people, those with multiple disabilities, so on and so forth. I do apologize if there's some noise. I'm right by Bruce Stevens, so let me know. But given as you've just listed, like, there are multiple hypotheses to potential causes for long COVID. Does this mean that there are potentially a lot more conditions that could make an individual high risk, so to speak, than we are being told?
I really think that's likely. And actually, I think a lot of people don't understand how long that list of high risk conditions really is. And that's really, I think there are two things to think about. One is the idea of having a high risk condition is kind of like that's telling you that right out of the gate, that a person with a high risk condition is at a higher risk.
Sure.
Many people actually don't know that they have those conditions yet. They haven't been diagnosed yet. Nothing has happened that kind of brought it to medical attention. And then there are more people who don't have any conditions that are on that list that may still have severe impacts. But I would tend to agree with you that they're probably, because we don't know what the mechanism of long COVID is or what multiple mechanisms there might be at play. Specifically, there may be more things yet to discover as far as things that put people at higher risk. But just to highlight a couple of things that people might not know as far as high risk conditions, that includes things like high blood pressure, diabetes, being overweight, being pregnant. I mean, pregnancy is just a normal physiologic state that many people in their lifetime encounter, and that is a high risk condition for severe COVID. It's on CDC's list. Mental health conditions, depression, for example. Many people don't know this, and so many of us are affected by those conditions, even if it's really well controlled, even if it's something that maybe you don't even have to take medication for, but it's definitely a bigger issue, and I really want to emphasize that all of us are at risk. It's not as if we can protect one small subset of the population. Humans are the people who are at risk for COVID, but we do know that there are some conditions that are even more concerning. So thank you for that question.
Thank you. JT, you want to go?
Yes, hi, I'm a reporter for Tone Madison, and I wanted to ask you, Doctor, are the setup that you've given for this portion of the presentation thus far seemed to be to push back, on conceptions that the, COVID, might be receding in terms of importance. I'm curious if you're seeing a similar relaxing of attitudes among your coworkers at UW Health.
Unfortunately, yes, I do see that there's a real tendency toward accepting the policies that are laid out and not going further to protect ourselves and protect our patients. I'm a pathologist, so I'm mostly behind the scenes, so I'm definitely not a direct observer of things that are happening on the front lines, but I know there are more people who are taking this seriously. I know there are clinicians at UW Health who are protecting their patients, and I really thank them. But I'm unfortunately seeing that there's a lot of unmasking going on when it's such a simple measure that could be taken to protect ourselves and protect our patients.
All right, I think that's it for the first round of questions. Thank you so much. I think we're ready to continue.
Great. All right. So this will be the second half. Probably this will go a little bit more quickly, but there will be time again at the very end for questions and hopefully a little time for discussion. So thank you for those great questions. So I wanted to start back up with a really horrible picture of someone spreading droplets as well as aerosols into the air to highlight that COVID is spread through the air in fine aerosols. So what you see here shows kind of a mix of particle sizes that you can just see with the naked eye. This is lit very cleverly so that you can actually see those particles. The larger ones tend to fall and they don't travel as far, but the smaller ones will float through the air like smoke. And here's a visual, another terrible visual. So this is probably the worst slide of the presentation in some ways, but this is cigarette smoke. And just to give you that idea, visualize in your mind's eye either cigarette smoke or like a vape cloud. Definitely don't encourage cigarette smoking or vaping, but this is a helpful analogy to visualize our exhaled air. The other way to think about it is when you go outside on a cold day and you can see your breath in the air. So the smoke tends to float around, and you can really kind of see that this is these really fine aerosols will hang in the air, and in indoor spaces, they can stay in the air for hours. So someone could be contagious in that space and have left the room, and they may no longer be present, and there may be infectious aerosols in that space. And you can see how that's important for a healthcare setting. So when we're talking about one-way masking versus universal masking, we can also talk about the types of masks. We hit on this a little bit in the earlier questions, but I wanted to give you some data about it. And this is a study that was again published by the CDC in their Morbidity and Mortality Weekly Report publication, and it came with this nice graphic that shows us a comparison amongst different mask types. And what's important to know about this is that this is a practical study. So this is in practical use. They included cloth masks here. This does help a little bit, but really at this point in the pandemic, no one should be using a cloth mask. That doesn't mean that you have to throw away your cute cloth masks. We can talk more about potentially how to use them safely, but you're going to want a double mask with your respirator underneath. Make sure a cloth mask fits loosely over it. When we're talking about masking to protect ourselves and to protect others, we should be in this medical mask area with either surgical masks or respirators. And I would strongly recommend a respirator, particularly an N95, but a KN95 that's from a reputable source is also really good. So surgical masks do help. And so if you're entering a healthcare setting where masking is required and everyone's wearing surgical masks and wearing them well, you are reducing the risk of infection in that environment. And I'll tell you, surgical masks work especially well for universal masking because they do provide some source control. They're not as great for protection because they don't fit and seal tightly around the edges. You can see how they're kind of baggy at the edges, and air can sort of leak out and leak in through those edges. So surgical masks are better than nothing, and they definitely should be the bare minimum for a healthcare setting. But we would really love to see everyone in an N95 respirator. And with an N95 or similar respirator in practical use, this is on a lower end of an estimate, we can reduce the risk of infection by 83%. That's a low number. So that is kind of underestimating the protection that you could potentially get from a respirator. So if your respirator fit perfectly, you can get upwards of, greater than 95% filtration, greater than 95% protection. But for the purposes of discussion and demonstration, we're going to take this 83% number as kind of a lower estimate. When we think about masking, we also want to think about all the other layers of protection that we need to use to reduce the risk really low, because I mentioned earlier, these COVID variants are really highly contagious. So in addition to wearing really well-fitting, high-quality masks, we can improve the air quality, particularly through HEPA filtration. We can use physical distancing and de-densify our spaces, get fewer people in a space, and that's going to be safer. Reducing the time we spend indoors, moving some gatherings outdoors, limiting our number of exposures, getting vaccinated and boosted, and using COVID testing appropriately and I would also add to this, monitoring for symptoms so that we can keep people who are sick or who have tested positive for COVID out of our gatherings and out of healthcare settings so that they don't potentially infect others. When we talk about respirators, there are a lot of different options. We can definitely talk more about this, but I recommend NIOSH approved options. NIOSH is the government agency that approves respirators for respiratory protection in occupational settings. And so this really tells you that your respirator is what you think it is. It's providing that high level of protection. So an N95 respirator is really important to use. Many people don't know, even now, 3 years into the pandemic, that they should be using an N95, or they never found one that really worked well for them. So I really encourage you, if you haven't found one that's comfortable, check out different styles and sizes. There are many things that we can kind of tweak as far as finding a really good respirator that fits and works well for you. There are also N100s or P100s and elastomeric respirators. We can talk more about that maybe at the end if people have questions, but these options do provide potentially higher filtration, but and potentially greater comfort, particularly the elastomeric respirators may be more comfortable for long-term use, but they're a little more specialized, may have a little bit higher investment as far as how much you have to pay. And 95 respirators usually are in the range of like $1 to $3 per mask. We also have KN95s or KF94s that I mentioned. I just want to emphasize it's really important to get these from a reputable vendor. We have a link here to Project N95. That's a really good place to get them. So why do we need universal masking? And we talked a little bit about one-way masking, and we're going to use this 83% figure. Again, that's a little bit low. If you get a really good seal, you can do better than that. But let's just take that as typical use. People aren't perfect. We might not get a great seal every time. We might not do it the same every time. So 83% protection on one side. If everyone, so we're modeling this with two people, if one of these people is infected and one of these people isn't, we're filtering 83% here, we're filtering 83% here. Our total protection doesn't just add, it actually multiplies. So we're getting a total of approximately 97% protection with the universal masking scenario. So you can do much better than the individual protection by using universal masking to basically provide source control. You can reduce the aerosols coming from potentially an infected person. So then your respirator, as a potentially non-infected person, you're breathing in even less at your respirator. The other thing about universal masking is that we know that patients can't always mask when they're receiving care. So big examples would be dental offices, any kind of procedures that involve the nose, mouth, or throat. If you have to eat or drink as part of the procedure, or just because you've been waiting a really long time, that would also be an example. Patients obviously can't protect themselves if they're either under anesthesia or recovering in post-operative areas where their breathing is being monitored. They may not be able to put a mask on right away after a procedure. And then, of course, patients may be specifically getting medical care when they're incapacitated or having difficulty breathing. And an example would be if you have to ride in an ambulance, you would really hope that your EMTs are wearing masks. The other thing I want to point out is that masking requirements in only high-risk areas is not enough. This is something that's currently being done in many healthcare settings. And what's really important, first, all patients need protection. It's not just specific risk groups. But immunocompromised patients, such as a patient who's actively undergoing chemotherapy, they aren't just getting care in a dedicated clinic. So they're not just going to the chemotherapy clinic only. They may need to get care in all parts of the healthcare system, a dermatology specialist, or they may experience a problem and have to go to another clinic. So it's really important to know that we can't do just the high risk part. We need to provide this for everybody. Shared spaces such as lobbies, hallways, waiting rooms, these are often not part of the high-risk designation, and these are spaces that patients and workers have to walk through in order to get to the high-risk space. So you're relying on one-way masking in these shared spaces where there might be a lot of people, including people who may be seeking care for a respiratory illness or for something where they may be infectious, either symptomatically or asymptomatically with COVID. The other thing is that masking protects both patients and workers. We know that we have healthcare staffing shortages. This article highlighted that Wisconsin nursing schools aren't able to graduate enough nurses to fill the vacancies. So it's really important to protect workers for their own safety, because we really want everyone to be protected, but also to maintain the integrity of our healthcare system. So I'll end this with the fact that all of us need safe access to healthcare. The end of the public health emergency means that also hospitals no longer have to report healthcare acquired COVID infections. And this, to me, is quite scandalous. This means that there isn't accountability for COVID spreading within healthcare settings. Removal of universal masking policies due to the end of the public health emergency is an example of our healthcare institutions that should be protecting us, following the politics and not following the science. There are some things we can do, and these are all available in the handout, so don't worry if you're not taking notes, you'll get all this information. First, we have our petition to reinstate masking at UW Health. You can join over 450 community members in signing this, and I really thank all of you who have already signed on. This is incredibly important, and it's been wonderful to see all of our community members supporting this. I mentioned NAACP's campaign to expand Medicaid coverage. You can sign on to that here. We of course recommend that you wear a mask, ideally an N95, the best respirator that you can get, the best fit that you can when you seek medical care, both to protect yourself and to protect others in the medical setting. And you can request healthcare masking as an ADA accommodation when you need care. Here's an example letter. These resources, of course, again, will be in the handout, and it's really important to ask for masking, to advocate for what you need and what you are looking for to stay safe in a healthcare setting. Obviously, the healthcare setting should be providing this. This should be a basic infection control measure. However, asking for it raises awareness and lets them know that that is important to you, and that can have more of an impact than you realize. You can also ask your senators to support tracking healthcare acquired COVID and to require masking in healthcare at a federal level through federal regulations and other actions that they have available to them. And you can do that through this Action Network campaign from the People's CDC. Finally, I want to thank you for being here. I want to thank you for spending this time to learn more. There are many ways to stay in touch. We have social media channels. Here are a few of my personal social media channels, and then our group's channels. I really want to thank our team. This was a team effort, so thank you to all of you who contributed to putting this together, pulling this off, running the technical aspects, and keeping an eye on the chat and helping field questions as we went along. Here are some recommended resources. I mentioned Project N95 earlier, the People's CDC, and then the National Week of Action to Keep Masks in Healthcare that this talk has been a part of, and I encourage you to take a look at these recommended resources. And with that, I will take some questions. Thank you.